meditation.
Guided imagery.
Guided imagery. What else?
Deep breathing.
Deep breathing. Okay. What are some of the negative maladaptive coping mechanisms?
Alcohol.
Alcohol. Think about your defense mechanisms. Look over those defense mechanisms, okay? So sometimes the compensation, the overgeneralization, look at those, okay? What are some of our interventions that we use for anxiety? For mild, moderate, severe, and panic.
Well, if it's not that bad, we could kind of like lessen the stimulus or stimulation or stimuli. I can't say it.
Stimuli, just lessen the stimuli. Quiet environment. Yep. Sometimes it's just listening. Sometimes it's just letting the person do their thing, and you don't need to do anything in mild at all. To needing to just have that quiet space, give you just directives only, to repeating instructions for moderate, or the information again. Okay. So, with the alcohol, what would you expect if you had a person under the influence and they're difficult to arouse? Would you expect their BAL level to be high or low?
High.
Very good. Okay. And what would you do for a bipolar in mania? And Courtney, you already answered the question with somebody with high anxiety. You would lessen what?
Stimuli.
You got it. Okay. And if somebody, what would be one of the symptomologies of somebody with bipolar mania that you might see with their wardrobe? Recognize.
It doesn't match, and it's off. Like if it's winter, they might wear a bathing suit out.
You got it. And their makeup might be overdone, way too bright. So it can be a warning. It can be a sign that they're not in balance. Okay, very good. What is carbazepam for?
It's a mood stabilizer.
Very good. Okay. Oh, we have not talked about this yet because it hasn't hit our chapter. We haven't hit the chapter yet. It's coming. But this is something that just was on one of the concepts of one of the version ones. When you see a child, especially an ADHD child, and you have parents that don't have great coping skills, it's a sign of child abuse. Does anybody have an idea what it might be? And it's not the typical bruises or broken fractures, that kind of thing. It's another sign. Does anybody have an idea what it might be?
Emotional.
Hair.
Oh, very good, Shiva. Misting hair. what happens is the parent grabs the child by their hair and drags them, pulls them. And you see hair loss. It can be chunks missing as a whole or thinning of the hair. And it's a sign of child abuse. We just haven't hit the chapter yet. Okay. Let's see. Command hallucinations. What's dangerous about them?
Risk for injury or for violence.
Yeah. So risk for injury to self or others. You got it. And so when you have a patient who you know is having auditory hallucinations, what do you need to assess?
You need to assess your environment and them mainly.
And
You want to ask them,
go ahead, Courtney.
you want to ask them, what are they hearing?
Yep. What are your voices saying? You got it. Very important. And what are they saying? And finding out if they're commanding. That's exactly right. What are they saying? Or are they commanding you? Okay. So, what are conversion disorders?
Isn't like those somatic?
It's within
Like
the somatic chapter.
Is that when a schizophrenic also has like depression or something?
No, not that one. Not Melinda schizophrenia.
Anxiety and drug use?
Nope. Usually it's still associated to anxiety.
That's when they think that they have like a bigger like medical issue. It's like they believe that they have a bigger medical issue. I wouldn't say a hypochondriac, but it's like
It's not the illness anxiety disorder. It's not that one. That's the hypochondriac illness anxiety. That's not that one. It's neurological in nature. This one has neurological in nature. If I put labile indifference with it, is it connecting yet?
it's when they don't see the importance or the severity of their injury or disorder.
They definitely are going to be nonchalant about what's happening to them, while everybody else is is very upset around them about it. So all of a sudden, whatever is going on, they neurologically, their brain stops a functioning of their body part. So they stop seeing, or they can't move a body part. Neurologically, there's an impairment that happens, but it is coming not because there's an actual damage to the body. It's coming because of mental illness. it's usually a trauma or when I say trauma, an emotional trauma that the anxiety is ridden that's causing it. Okay.
Is it like when someone's been in a car accident and they can't really speak about it? Or is that different?
That's different. That's more of a repression of the event. This is okay. So I did that example of my mom going blind when we got to St. Louis as I'm moving to Florida, because she was just real upset about the fact I was moving away from her. Okay. The other example I typically also use was the 15-year-old who woke up one morning at home and she no longer had any control of her bowel bladder, nor could she move her legs. They had to call rescue,